I mean, our organization started quite organically, I think. I am a kidney transplant recipient, and I had a transplant 15 years ago now, touch wood. Just came back from my annual appointment. It is a genetic condition, and only about 10%, maybe 10 to 20% of kidney disease is genetic. And two of my three daughters also have it. So I think my dad also had a kidney transplant in all of this. And so even though it's not a rare disease, although genetic mutations within the kidney spectrum are more rare, but there are huge challenges in the patients are facing. I face them. Generally, each patient is facing that on their own, trying to struggle through something that many people in their inner circle don't know much about and can't really help them with, oftentimes, unless it is genetic, which is the minority. And so, myself kind of getting through it, kind of limping through it, and then watching my daughters try to get through it and seeing how they struggled. And if I hadn't been there to help them, just would their outcomes have been much worse, because I had to, be quite involved in helping to move them through that process. And so because of my own personal experience, I with the help of a researcher in Canada, I started a program called the Transplant Ambassador Program. And so the intent of that was that it would be, again, an all volunteer-driven program where people who had gone through it, because most of us only go through it once, ideally, can help and other people, like with the benefit of their experience and hindsight and all those things, and that was really missing, when I went through it, from my perspective, and also being able to connect people with someone who is similar to them, someone of a similar age, someone of a similar background. That's almost next to impossible. And I know when I was going through it, I was in my late 30s, early 40s, and I didn't want to be connected with a 75-year-old man. And that's what I was afraid of, right? Like I was just like, I won't have anything in common. So we have the same disease, but I won't have anything in common with them. And so I really felt it was really important to connect people with people who are similar. And that required a bigger pool of volunteers to be able to do that, right? And so as we launched the program, we officially launched it in 2017, and we were able to get involved in all of the hospitals in Ontario in the first instance. So that's 27 hospitals that provide kidney care. And we now have over 200 volunteers in across Ontario, and we're trying to move this forward to other provinces, as you mentioned. We started to document anonymously challenges and barriers that kidney patients were facing. And although we were meant to be, working within the care system and in partnership with the care system to support patients and to hear them and to be a listening ear, we just heard all of the challenges and the problems and the gaps that people were facing. Then it seemed to be, it became for us a much bigger issue. Like it became more like, how can we help these people? Like it's not just about listening to them, but it's about doing something bigger and larger. And that's when we decided that we needed to do more advocacy. We as patients, we needed people to hear us, and we needed a more collective voice, because individually, nobody could really move anything. So, so creating that community of people was key, and nobody was doing it. I mean, we have various kidney organizations, but none of them were about organizing the patients themselves to speak for themselves. And so for us, we really wanted a patient-led organization. And by that, I mean, so we have kind of two patient groups in our population. So one is the patients themselves, and the other are living kidney donors who also kind of don't have a community, but face, really specific issues that can benefit from talking to a peer. And so we brought together, those two groups which was really interesting, because the one group is kind of have a chronic illness, and the other group are like the most healthy of the healthy, but yet equally passionate, and so we created the nonprofit so that we could continue to grow that program, because originally it was kind of part of a research initiative just to see if this peer support would help. But, as the program wound up, which was just a few years ago, we started thinking, but we don't want to lose this program, and we want it to stay in the hands of patients. So let's start a nonprofit that we can continue this program, but also do other things, to do more advocacy and really elevate patient voices, which we really feel were being heard or being really at the table. We were kind of being represented by other people, whether it be healthcare providers or other organizations, but not really patients themselves out there talking about what they were seeing, what they were feeling, what they were experiencing. Yeah. So that's how we created the organization, just to be able to, organize and mobilize and that kind of stuff. So we created the Kidney Patient and Donor Alliance to be kind of that advocacy arm of representing patient concerns and moving forward. So the first real concern that we all really wanted to see tackled is the lack of access to transplant. So few people are getting transplant versus the number of people eligible to get a transplant, and even just the fact that the system, because it was built prior to transplant really being a perfected, surgery. Our system is built around a dialysis model, right? And it's everything is built around this dialysis model, and then transplant is kind of over at the side, even though it's a proven effective, like such a much better treatment from a quality of life perspective, but also from a financial perspective. It's actually a much cheaper alternative, and far cheaper than dialysis. And so we really thought, why can't we need to advocate that more of these people who are eligible, which in Ontario is about 50% of patients on dialysis are eligible, based on some recent studies, which are only fairly recent. But why are only 5 to 6% of people getting transplanted? There's like a really big gap, and it shows a systemic problem, which I think is the next. It is a bit complicated, but I think at its root, it's really about education and information. Like, even through our transplant information, through our transplant ambassador program, we as a volunteer group that are kind of semi incorporated into some of the hospitals, we find that we're often the first people to have a real conversation with people about transplant. So they've heard about it, it's in the background somewhere, but do they really know what it is, or how it works, or how successful it is, or what the benefits, the pros and cons are? No, we tend to be the first people to have those conversations, which we know is just because there aren't enough resources to educate people, through their kidney journey, right? So some people have acute kidney, injury, and they're on dialysis immediately, but the majority of people, it's a long progression of getting, of your kidneys declining. And there's lots of time. There should be lots of time to have those conversations about transplant and how effective and beneficial and the huge benefits of transplant. Yet when we talk to people, they have no idea. They have no idea. They think dialysis and transplant are similar. They don't understand the benefits from a quality of life and a longevity of life perspective. And so we're kind of sharing that information with them. There's an element of denial as well. And some people is just like, I don't want to know. I'll figure it out as I go along. But I think the medication that prevents and helps delay kidney disease is like, it's changed in the last 5 to 10 years. There's so many more medications on the market that can actually help people. So it's like, get involved in your, understand what your disease is, understand that there are things that you can do about it. It's like when I had my kidney disease, so I've been transplanted 15 years, but I was followed for 15 years before that. There really wasn't anything on the market. Wasn't anything except for wait for your kidneys to fail. That's not the case anymore. But yet that information is not getting out to patients. Patients don't understand that, and they should be. They want to be followed early as possible. They want to take advantage of these medications, and if transplant is something that's in their, in their future, then they want to know about it. They want to get, start to be comfortable with it. And our goal, when we first started our program of transplant ambassadors, was that they were able to see us. That they could see us in the clinics, that they could see that we were living productive, healthy lives, even though we still have kidney disease, but we're, successfully transplanted, and the lifespan and the quality of life is like pretty much like a normal person, other than the medication that you take, right? But again, people are afraid of that. We can help dispel some of those myths around that. And again, the medications have, become much better. So really, it's really about education and information and dispelling a lot of these myths that still exists. This thought that the kidney disease isn't treatable. It is. Prevention is possible if you get it early enough in many cases. And transplant is a really good alternative, whereas dialysis is not. The average time, people don't understand that. They're just, okay, you need to go on dialysis. Some people think they're going in for one treatment. They have no idea. This is a lifelong 3 to 5 times a week, 3 to 5 hours a day treatment. This is arduous. And in fact, the lifespan on dialysis is, 5 years.
Yeah.
The prognosis is not good, but yet people aren't given that information when they move on to dialysis. It's like they don't understand that.
Right.
And so, it's really about having the information you need about your disease, and it's not
Right.
really there. Yeah, so for sure we have a lot of plans. We're focused on a lot of our advocacy right now is focused on government. From the perspective of our story is not about we need money. Our story is we need you to reallocate the money that you're currently spending so that there will be more funding for other things. Like there is so much savings to be had out of moving people off dialysis and into transplant. We're talking about billions of dollars. Like dialysis is the most expensive treatment that there is. It's a lifetime treatment. It's $100,000 a year per patient. Like it's massive. Like my own transplant has saved the system $1.5 million. Like, if I had been on dialysis that long, like it's just one person. So when you think about 30,000, people on dialysis in Ontario or nearing dialysis, this is a huge cost savings that could be redirected to other areas of healthcare, not even just, to help the patients that are currently waiting. So I think, for us, it's really about getting the message out there that transplant is an effective, accessible, it's the optimal treatment. Let's work together to kind of reform or reframe the system so that, and everybody knows this, like from a healthcare perspective, they know it. Sometimes patients don't 100% know it, and certainly government doesn't really know it, and they don't. And so for us, it's about getting the message out there that the system isn't working. First of all, the system isn't working for patients, and that message hasn't been told. That story hasn't been told. The message hasn't been heard, and so we want to, similar to what was already discussed, like we want to create this organized network of patients who can say collectively, this system isn't working. Patients aren't being properly cared for. There are better ways to do this, cheaper ways to do this, and it needs to be done. So our message is focusing on, government to some extent, as well as just building that network, creating that stronger voice together. Like I love this story, just a quick story, but before I was a part of the Alliance, and I was just kind of a regular person, but trying to gather information about why more people weren't being transplanted. So this is probably 15 years ago, or something like that. And I was kind of meeting with different hospital administrators and such. And so I met with the supervisor of a large transplant center in Ontario, and I said, why are so few people being transplanted, and why do we not, like, why is this not common knowledge? Like, what do we know about it? And his comment to me was, they've advocated as much as they can from within the system, but they have a conflict of interest, an inherent conflict of interest about, calling out, a system that they're part of. And they said, until patients, like, I never forget it, like until patients stand up and say the system's not working for us, nothing will change. And so that was like a really catalyzing moment for me to say, you got to start to speak up. Because it's just getting, honestly, it's just getting worse. The crunch on our healthcare system is so big, and patients who are in the throes of their illness, it's very hard for them to advocate. So those of us who are on the other side of it, we have a responsibility
to advocate on behalf
and support those people who can. Yes, absolutely. Right now Canada is 14th in the world in terms of our transplant, rates. So there are 13 countries that are doing better than us, and we have a lot to learn from those countries. And that's so just bringing this issue forward and saying, let's examine this, let's work together to create a better system where fewer people are just falling through the cracks. When they don't need to be, when we actually have a really good process and system, but the efficiencies and the knowledge and the information is just not there. So if we were to have better metrics, standardization across these centers, which there isn't, chronic kidney disease is not even recognized as a chronic disease in Canada. despite the numbers. And so if you're not recognized as a chronic disease, the country's not monitoring it. The standards aren't in place. And, so even that would be amazing, and then monitor it, like, so that, even here in Ontario, where we have 6 transplant centers, they all have different processes. And one is not like the other. And as a patient, how can you know that? That information is not public. But some hospitals, have much better transplant rates than others.